A new study shows Wisconsin may be headed towards a shortage of doctors. News 8's Pauline Lee joins us live in our studio with a closer look at the problem.
Well, Mark, in the next 20 years, Wisconsin could be short about 2,000 doctors. Local doctors say this could lead to a decrease in quality care. The hospitals in our area say they know how to fix the problem. It's just getting there that's the tough part. For Dr. Derek Woodward,
he's a patient of mine.
After growing up and completing his education in Wisconsin, he couldn't think of a better place he'd rather live.
It's beneficial to kind of know the local resources. Every community is different. So if you can train in an area where you're going to practice, you get it can definitely be helpful.
But Dr. Grau, director of the Family Medical Residency Program at Mayo Clinic Health System, says that's not the case for everyone.
For the past 10 to 15 years, we've seen less interest in family medicine and other primary care specialties for that matter.
The Wisconsin Hospital Association reports while there may be enough doctors to take care of everyone now, if changes aren't made, Wisconsin could experience a shortfall of 2,000 physicians by the year 2030. One of the main problems is recruiting students to practice in rural areas, and that's something Gunderson Lutheran has been working on.
Wisconsin Academy for Rural Medicine, which is a new and innovative program for Wisconsin medical students who come from rural areas and who demonstrate a commitment to practice in rural Wisconsin.
Besides new recruiting programs, they've also increased class sizes and worked more closely with medical schools in the state. But both hospitals say more needs to be done.
We need more students coming out of medical schools. We need to be training more physicians, and we need more residency training programs to then provide residency programs for that increasing number of graduates. But the funding of those programs becomes a huge issue.
And hopefully, if these changes are made, more physicians will follow Dr. Woodward's lead.
I've signed to actually stay with Mayo Clinic Health System. I'll be practicing in Sparta next year.
Well, the demand for more doctors becomes greater with an aging population and more people having access to health care.
All right, thank you, Pauline. The study says Wisconsin needs to recruit at least 100 physicians a year for the next 20 years to keep up with growing demands.